Welcome to the European Parliamentary Research Service podcast on addressing shortages of medicines in Europe.
The coronavirus has highlighted the EU's dependency in countries outside its borders for the production of many active pharmaceutical ingredients and medicines. It's not a new problem, but it has become painfully exposed in the past weeks.
So why is that, and what can the EU do about it? Never has a debate been timelier. Stay with us.
Medicine shortages have been a growing problem in the European Union in recent years, and the risk of bottlenecks in the supply of medicines to patients has become particularly real amid the unfolding coronavirus pandemic.
In early April 2020, for instance, hospitals raised the alarm that, with rising demand for the medicines needed in intensive care units, such as sedatives, anaesthetics and antibiotics, stocks could soon run out.
The World Health Organization also cautioned against using medicines that have not been demonstrated to be effective against COVID-19, as this could leave non-coronavirus patients without medication that has proved effective against their disease.
So why is Europe facing medicine shortages?
Well, there's not a single cause, but several. For instance, manufacturing difficulties or problems affecting the quality of medicines. But according to the European Commission, there are other reasons, such as industry quotas, legal parallel trade and economic aspects, such as the pricing of medicines, which is decided by member states. So shortages of medicines are part of the wider problem of access, affordability and availability of medicines in the EU.
And with the coronavirus crisis, the geopolitical dimension of medicine shortages has become clear, highlighting the EU's dependency on countries outside its borders, especially China and India, for the production of active pharmaceutical ingredients and medicines.
According to recent news reports, 80% of the active pharmaceutical ingredients and medicines and 40% of finished medicines sold in Europe come from China and India, although especially from China.
Together, these two countries produce 60% of the world's paracetamol, 90% of its penicillin and 50% of its ibuprofen. So, in the context of the coronavirus crisis, some political leaders have highlighted the need to start producing medicines in Europe again. But is this the solution? What can the EU and member states do to prevent medicine shortages in the future? Stay with us.
Tackling shortages and ensuring that patients can get the medicines they need requires measures both at EU and national levels. It requires collaboration and joint action, as well as the involvement of multiple stakeholders, including regulators, industry, patients, healthcare professionals, and international players.
EU institutions have addressed this challenge through various initiatives and laws. Companies, for instance, are required by the EU to ensure a continuous supply of medicines and to warn the authorities in time of any potential disruptions.
The EU also encourages the exchange of information between member states, and questions related to medicine availability in Europe are discussed in several forums, such as the Pharmaceutical Committee, which brings national public health experts together.
To reduce dependency on China, the Commission has also begun to explore the possibility of producing active pharmaceutical ingredients in Europe. And in the context of the current pandemic, it issued some guidelines to avoid shortages of medicines and establish a coordinated approach across Europe.
These guidelines included such measures as lifting export bans and restrictions to facilitate international solidarity, increasing production, setting up green lanes to facilitate a quick and fair distribution of medicines, and supporting research to find a vaccine against COVID-19.
According to the European Medicines Agency, improving the availability of medicines authorised in the EU is crucial, as shortages can have serious consequences for human health. To this end, it is continuously monitoring the situation and facilitating exchanges of information and best practices between member states and bringing stakeholders into the discussion.
Now, what do European institutions and key stakeholders have to say? Stay with us.
Well, the European Parliament already addressed the issue of medicine shortages 3 years before the current pandemic, and it asked the Commission to put a better reporting mechanism on the causes of this problem in place.
The issue has also been addressed by the rotating Council presidencies, and in recent years, member states have started some voluntary cooperation initiatives on issues such as pricing and reimbursement of medicines.
The Organisation for Economic Cooperation and Development and the World Health Organization in particular are both conducting work to improve access to medicines and keep them affordable for everyone. And medicine supply chain stakeholders have all weighed in on the debate and given recommendations for addressing the problem.
Producers of generics, for example, recommend cutting the red tape required to keep medicines in the market or to introduce specific regulatory measures to mitigate imminent medicine shortages. And European parallel traders selling pharmaceuticals cross-border recommend short-term parallel imports to fight against shortages.
Noting the ongoing rise of medicine shortages in most European countries, pharmacists' associations have also called for a number of coordinated actions, such as ensuring availability, widening professional competence, improving communication, compensating for financial impact, and developing effective governance systems, all to reduce the impact of medicine shortages on patients.
So what can we expect in the coming months?
Well, the Commission's study on medicine shortages is expected to cast some light on the current shortages and the reasons behind them, as well as an assessment of what can be done legally and the pros and cons of future possible action.
Medicine availability and supply chain problems revealed by the coronavirus crisis are also expected to be an important theme in the Commission's forthcoming pharmaceutical strategy. So stay tuned.
You're listening to the European Parliamentary Research Service podcasts.